5 on Friday. My name's Dave Ford. I'm the course coordinator of postgraduate paramedicine at Edith Cowan University, and I've been asked to speak to you today about helicopter retrieval of trauma patients, particularly those patients that are going to benefit from direct helicopter retrieval from the accident scene to a trauma centre. That's as opposed to patients that may go indirectly to a secondary or country hospital prior to going to a trauma centre. So just a bit of background on trauma in Western Australia. Trauma remains the leading cause of death up to the age of 45 years. And for patients who receive major trauma in country Western Australia, the mortality is up to 4 times higher, the mortality rate for those patients, than it is for major trauma in the metropolitan area. Now, even though Western Australia is a huge state, the 90% of the population are within the operating zone of the state's rescue helicopters. For patients living outside of that operating zone, then they're most likely or best retrieved by fixed-wing aircraft. For patients living in the metropolitan area, helicopter retrieval is usually not indicated unless there is some sort of access issue. Let's talk for a minute about direct versus indirect helicopter retrieval. Patients who are retrieved directly from the accident scene by helicopter and taken to the trauma centre, it's reasonable to expect that they could be transported from the time of incident to the trauma centre within 2 to 3 hours. For patients that go via a secondary or country hospital first, the median transport time is over 9 hours. But clearly we can't transport all trauma patients from the accident scene by helicopter to a trauma centre. So the important thing is try to determine which patients are going to benefit from that helicopter transport. For patients with catastrophic injuries, transporting them by helicopter is unlikely to affect the outcome. For patients with minor injuries, likewise, transporting them helicopter is again unlikely to affect their outcome. The patients that we're looking for who are going to benefit from helicopter transport directly from the accident scene to a trauma centre are patients with serious but survivable injuries. So what are some of the things we're looking for? So some of the measures that have been demonstrated to be independent predictors of survival for major trauma patients when transported by helicopter directly from the accident scene to a trauma centre include a Glasgow Coma Scale less than 14, a respiratory rate less than 10 or greater than 29, if the patient has suffered penetrating trauma, or if the patient is greater than 55 years of age. There are some other measures used to try to determine whether helicopter transport is appropriate for major trauma patients, and they fall into either physiological or anatomical measures. Some of the other anatomical measures include things like a suspected tension pneumothorax or hemothorax, injury to more than 2 body areas, if the patient has a fractured pelvis or suspected fractured pelvis, or if the patient has signs of paralysis. So in summary, the mortality for major trauma in country Western Australia is up to 4 times higher than what you would find in the metropolitan area. Although Western Australia is a massive state, 90% of the population is within the operating zone of the state's rescue helicopters. And the sort of patients who are most likely to benefit from that are patients with serious but survivable injuries. This has been 5 on Friday. My name's Dave Ford. Thanks for watching.